everybody, what's going on? It's your girl Nurse C with the Medical Tea, and I'm coming to do some updates with you. So last time we talked, I talked about basically safety and cleanliness, if you need a mask versus if you don't, and things like that. So now I want to update you about actually how you can be helpful in to stop spreading this disease, and how your cooperation is so very much needed for a very overwhelmed healthcare system. So right now, healthcare workers, healthcare providers, we are very, very, very overwhelmed. We are very short of supplies, and we want everybody to be safe. No provider wants to be in a position of who lives and dies. This is why we're asking for you guys to stay home. This is why we're asking for self-isolation and quarantine. This is why we're asking for social distancing. This is how serious it is. And I'm going to make it very personal for you guys so that you can understand the severity of the situation we're in right now. We are running out of ventilators, guys. This is life-sustaining machines for people who cannot breathe on their own. And because this virus is attacking your respiratory system that we know about right now, and for people who have underlying conditions, the doctor, provider, nurse practitioner, all of these people have to start making hard decisions of who lives and who dies, like they're doing in Italy right now. The United States doesn't want to be in that position. That's why we're asking for your help. You know, it was a really nice day the other day, and I think people are just not taking this as serious as they need to. It was a lot of people in Calvert Park. It was a lot of people just out and about, and it just wasn't right. Like, you may be healthy and you may have a baseline of good health, but the person next to you may have underlying medical conditions that you don't know about and unknowingly spread the virus to them. Now, that good day that you two just shared ended up with one of you in the hospital on life support. And guess what? If we don't have enough ventilators, they may not make it to life support because it may be somebody else who needs it, that medical condition warrants for them to be able to make it, and then the person you were with not. And that's how serious this is right now. So please, 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 we're asking you. We are very overwhelmed in the medical healthcare system right now. Very overwhelmed. And we cannot get a handle on this if you guys don't help us out. So staying home, self-quarantine, things like that, this is what's helping. We want to get a handle on this, and we want the spread to stop. But if each day new cases pop up because people are not staying home and, listening to what we're asking them to do, we can't get a handle on this. So we're going to be, the healthcare system is going to bust. That's what's going to happen. And nobody's trying to be scaring people or anything like that. We just want you to understand the severity of it so that people don't take this lightly. It's not a light virus to take. It's taking this healthcare world by storm, and hopefully you guys get a better understanding of what's going on right now. People that are in the hospital with other conditions can't have visitors. That's that can be very detrimental to someone who lives for people to come see them that's in their family. People are having babies, which is a joyous time. Unfortunately, can't have anybody come and visit them and share the joy of their baby. Even when they go home, they can't even share the joy in this new life here because we have to be so careful right now. So I'm asking, if you guys stay home and you guys follow the guidelines of quarantining right now, this will pass sooner than they're projecting. But if you guys don't listen and try to follow these rules, then we're going to be dealing with this for a long time. So I'm asking for the safety of you, for the safety of us. We don't have supplies. We're putting our lives at risk. Healthcare workers, people in the industry, we are putting our lives at risk to take care of everybody, because it's not just corona. It's meningitis, it's TB, it's cancer. It's not just corona. And we go to work. We have signed up to be in this field, but we did not sign up for people to purposely put our lives in danger. So I'm asking you guys to listen to the healthcare professionals right now and stay home. Practice social distancing when you go out. Wash your hands for 20 seconds or more. If you're fairly healthy and you don't have an underlying medical condition and you start to be symptomatic, this is something that could be managed at home. with underlying medical conditions, diabetes, heart disease, cancer, asthma. These are the people that are most vulnerable, elderly, very vulnerable people. And if you are symptomatic and you feel that you're having shortness of breath, you need to come to the ER. But don't overload the system. If you're a fairly healthy person, you don't have underlying medical conditions, and you're able to manage at home, please stay home. Please nurse yourself back to health, and try to save this space for people that need to be in the ER, that need to be in the hospital. And again, please, please, please educate yourselves as much as possible. Go to the Center for Disease Control, www.cdc.gov, and also World Health Organization, better known as WHO. So these are the two verifiable websites that you can go on to update yourself. Let's lessen each case each day, and let's listen and stay home and enjoy this time with our family and immediate family that's in the house. No visiting, no parties, no nothing like that. I really just want you don't see what I see, but I want to give you a glimpse into my window. So help us all out and stay home right now, okay? Thanks again. It's your girl, Nurse C with the Medical T. If you have any questions or concerns, you can always email me at flawlessnurseboss.com. flawlessnurseboss@gmail.com. So, okay, that's it. Thank you guys, and pray for us and pray for yourselves, and hope we can get this thing under control. Also, I want to give a shout out to my family right now. We're going through a difficult time with one of our family members, so please keep us in your prayers. Thank you. Bye.